Morning.
Good luck, my friend.
Good morning, Mark.
Good morning.
Good morning, everybody. Okay, I'm going to call this emergency meeting of the Board of Health to order, and in accordance with Governor Baker's executive order permitting virtual meetings during the COVID pandemic, the Board of Health is conducting this meeting today, December 27th, 2021, on the Zoom platform and in accordance with the town's policy directive and guidelines issued on April 1st, 2020 as amended. I ask that all Board of Health committee members, town staff, and presenters activate their video and mute their microphone unless they have something to say or are participating in committee dialogue. This meeting is being recorded and will be available for later viewing on the town's website. All committee votes will be taken via roll call. We will start with an attendance roll call. I will announce your name, please reply. And for members of the public, please unmute yourself when I've opened the meeting to public comment. So I, Jill Block, I'm here. Alma Healy.
Present.
Mark Haddad.
Present.
And Ray Considine.
Present.
Thank you all for coming today, and I really appreciate everybody else showing up for this emergency meeting, which I did call because even since we met just 2 weeks ago, the level of concern for COVID has escalated dramatically in recent days due to the Omicron variant and its transmissibility. I think throughout the pandemic, we've paid really close attention to the science and the data, and we've acted accordingly. And I just think it's important before we really get into any kind of discussion about the use of a mask mandate. I just want to acknowledge that, there's people who have really passionate thoughts on all sides of these issues, mask mandates, vaccination, et cetera. And, we're working with the best tools we have to make our decisions. We take it really seriously, take our mission to protect the common good of Concord's public health really seriously. And that's been foremost in our deliberations. I want to acknowledge that the health department has been hearing from people with very passionate feelings about all of this. And I feel for them having to be the public face of the decisions that are often made by us and by the state. And really appreciate their professionalism and perseverance in the face of a lot of community opposition or passion, feelings about this. So anyway, thank you, Karen, Gabby, anybody else that's really on the front lines or the face of the state, face of the issue for the community. I'm really grateful. So, we've been hearing a lot about the need for a mask mandate. I know that there's been talk about how Concord stands out in our abutting towns in that we don't have a mask mandate. I think it's really important to know that when I look closely at the data, 14-day average incidence rates and 14-day positivity, and these numbers only go up till December 18th for a townwide data, is Concord shows up straight in the middle. So we, by not having a mask mandate, do not appear to have caused any further rate of infection and positivity within our community. So I feel very comfortable with the decision that we've made to date about not having a mandate. It has not put the community at any greater risk. But what we do know is that, right now, with Omicron, there's a lot of breakthrough infections. The best thing that anybody can do is get vaccinated. Right now in Concord, we have 83, this was as of, again, the 18th, 83% of the town is fully vaccinated. That's like a 15,547 out of 18,731. So presumably that's including children under the age of 5 who are not yet eligible, right? So we've done a really good job of vaccination. And I think the level of booster shots is a little less than 83%. I had the number somewhere, but it's still pretty high. Vaccination is definitely the best thing everybody can be doing. And I recommend that everybody get their booster if they haven't. Even with that, it's really important to know that, there's breakthrough cases. In 99.9% of breakthrough cases in fully vaccinated people under the age of 60, nobody's dying, okay, which is great. There's also 97% of nearly all breakthrough cases in the Commonwealth have not resulted in hospitalization. So that's great. So vaccination is really, really important and the best thing we can do. And I really encourage everybody to get vaccinated. I personally would love to see stronger mandates for vaccination. And I know that's a whole level of controversy, but that's my personal opinion I'll voice there. Oh, here it is. So 83% are fully vaccinated. 43% of Concord residents have received booster. So that's really good. So the next level of protection really is masking. And I think the state has been very clear in strongly recommending masking. And when I look around anecdotally, in many cases, we see masks. And I think people in Concord have done the right thing. But, our borders are not solid. Everybody can come in here. We can't limit our community to only residents of our community. Given that, and given the plea from hospitals that I keep on hearing, that the hospitals are really, they're at a precarious point. They don't want to get into the position that they were last year with things limited to only COVID and everything else put aside, no visitors. We don't want that to happen. The hospitals are pleading for everybody to get COVID-19 and flu vaccines, and they're advocating for us always to wear a mask in public when social distancing is impossible, and to get tested when you do have symptoms. One of the things that we were talking about in this before this officially started is that testing data is no longer really accurate with the level of home testing now available, because that data is not getting reported. So we don't necessarily have an accurate sense of the testing data and the incidence rates. Anyway, all of that's to say, this is kind of the level of information that I've been grappling with in my own head about whether or not mask mandates are important. I still remain conflicted, but I also hear that people really want them. So I want to hear from other board members how you're feeling about this as of today. If anybody wants to take a stab at responding to the idea for a mask mandate.
Well, I love the way you started with a great report that we have done well with the decision we made the last time. And I understand things have changed somewhat, but I like also the aspect of what the hospital has set up, and they're not going backwards, but yet they're not abandoning good common sense. So my feeling is, if we're doing well, as you reported, I'd like to see it remain at that point with the mandate that we spoke about at the last meeting.
You mean with the idea of putting one in place now?
Remaining the same as what we have in place now.
With not requiring it?
Yeah.
But strong recommendations for it?
Right.
Okay. Ray, I know at the last meeting your feelings were for one. How are you feeling today?
Well, first of all, thank you for that terrific summary, Jill. That was, I think, very helpful. Looking at the data, I noticed that back when we met on the 14th, the case positivity rate in Concord was 2.51. And in the last data release that you cited on the 18th, I saw that it had grown to 3.45. So that's about a 40% increase in positivity. And there's no telling where it's going in the next 2 weeks and how it will increase. We know that masks offer, I think, the best protection, certainly vaccinations and boosters, as you point out. But next to that, we know that masks offer very good line of protection. The CDC recommends wearing a mask in public outdoor settings. I don't think that has changed. And I think
public as you indoor settings. I'm sorry, Ray. You said public outdoor.
Public outdoor settings. I mean, they don't. I'm sorry. Public indoor settings. Excuse me. Thanks. Thanks for clarifying that. And I think, while we're doing a very good job in Concord. I think, credit to a lot of people in the health department, in the schools, and just the general public's paying attention to this with high vaccination rates. We don't live in a bubble, and particularly for the business community, there's an influx of people from, outside cities and towns, and that may increase. Certainly, it's increased over the holidays, and I worry because I look at surrounding towns, and those case positivity rates are significantly higher than Concord's. I sort of look at the in public health we embrace the precautionary principle, and that I think, yes, there will be some on one side that will say this is overreach, but there are certainly other opinions that say this is a prudent approach to take. I don't think, because people are embracing it, I don't think it's a huge reach. I think it offers protection. It's a rationale for shop owners where you can cite the health department taking the steps to require masks. And I think some businesses have already spoken to me about why are we dragging our feet on this. So I haven't changed my position. I think it's a prudent approach to take. I think we don't need to leave it in forever. We can look at it in 4 weeks, or we can look at it when the county gets below the substantial or high risk rating, and we can rethink it. But right now, I think it's time to institute a mask mandate.
Thank you. So it was interesting because you cited the statewide level having gone up like 40%. So the statewide level.
No, I meant the Concord.
Right. The Concord level. So the 14-day positivity rate for Massachusetts on the 18th was 5.66%. And as of 12/23, and this data doesn't exist for Concord, it's just the state, but the state in 1 week went from 5.66% positivity to 8.32%. So I would assume that it's similarly climbing around the state and other towns. I mean, that's a presumption. I don't know for fact, but it is a rapid increase for sure. Anyway, I'd love to hear from you.
I mean, that's kind of consistent. I mean, it's actually a little higher than the increase at Concord. Concord was about a 40% increase. This looks, right, just off the top of my head, it looks more like closer to a maybe a 50% increase. Right. Over that period of time. So right. It's growing.
And that's not counting the increase in the use of home tests.
Right.
So we can probably assume it's higher.
Yeah.
Jill, if I can just interject, I'm the Board of Health nurse. I work with Trish McGean, who is on vacation. So I just ran the numbers, and I'm not going to give my opinion. I'm just going to give you the data that I currently have from our Department of Public Health portal. If you want those actual case numbers.
Please.
So I just did a total for the month of November, just as a reference point. Concord had a total of 87 confirmed cases. For the weeks of 12/5 through 12/12, there were 39 cases. For the week of 12/12 through 12/19, there were 48 cases. And for the week of 12/19 through today, there were 79 confirmed cases. So we have, since December 1st, Concord has recorded a total of 171 confirmed cases and 24 probable cases, which is just the way the Department of Public Health qualifies, labels their cases. It's an antigen test versus PCR test, but it's actual COVID cases.
So you said that was from 12/1, 171 confirmed?
As of today.
As of today. Okay. But as of since December 1st.
Since December 1st, those are the numbers I just ran in our portal.
So that's, I don't have the numbers for November, but that's a big leap from November if that's.
I had total cases for November, confirmed cases were 87.
Okay.
So that's my data input, just for your consideration.
Thank you for that. And my sense is that the vaccination rate was already at a pretty high level as of December 1st. I mean, at least the 2-dose, not necessarily in the children.
Yeah, and I just did a quick look. Out of those 171 cases, 100 of those cases were vaccinated in some fashion. But I know Trish has run the booster clinics, so you know that would be additional data.
Right. And we had Trisha had provided us numbers. We had the numbers that were as of December 8th, I believe. So it's really gone up dramatically even since then.
Yep, that's what I'm seeing. I know as an employee of Emerson Hospital as well, they sent out an update on the 23rd, and they are adjusting their approach inpatient wise with visitors and those normal activities that they have tried to mitigate. So Emerson is as of the 23rd, they had adjusted their visitor policy in all settings.
And have they changed anything about elective procedures as of this time?
Not as of this time, knock on wood, because that would be.
Do you know what the capacity is in the ICU or emergency room cases?
So they had, as of the 23rd, they have 12 positive patients with 2 under investigation.
In the ICU or?
Just, it doesn't say whether it's ICU or it's just inpatient positivity.
Okay.
And I don't know what their ICU capacity, but I have not heard that we have, you know, maxed out at this point. But that's, you know, the number of cases that has jumped. This is reflective of, you know, post-Thanksgiving and possibly holiday gathering, pre-holiday gatherings. We really won't know the numbers till this coming weekend or early next week, you know, as far as what happened over the Christmas holiday specifically.
Right.
I anticipate an increase, and that you're correct with that. It does not include home antigen tests. And the availability of both home antigen test and PCR testing is absolutely, it's really difficult, is what I'm hearing from people that I'm talking to when I do my case investigations. They're scrounging to get, the urgent cares were maxed. You couldn't get an appointment till, for last week, you couldn't get an appointment till this week for the local urgent cares around us. So the testing availability is definitely an issue. So I feel like the numbers, this isn't an accurate reflection of actual cases out there.
Right. Thank you for all of that. That's really helpful context.
You're welcome.
Mark, what are you thinking?
Yeah, so I mean, I'm definitely, you know, I've been torn on this the whole time, including last meeting, but I think hearing all the numbers, the trend seems like a pretty clear upward trend. I think, you know, we shouldn't wait until it's dire emergency and the hospital is full to do it, because if we do that, we're going to be sort of too late. I don't, you know, with all due respect for people who feel strongly anti-mask, I don't really think it's such a big deal to ask people to wear a mask in a public setting. I think we need to be careful how we write the rule. If we were to adopt a rule, I think it should apply to, you know, public retail spaces, places where people from the public would be. It shouldn't apply to, you know, a private business with their own employees. They should be able to make that decision for themselves, whether it's work from home or whether they mandate vaccines and then choose not to do masks or choose to do it, whatever. But I think I've gotten to the place where anything where, you know, the general public, anything that's sort of open to the general public, at least on a temporary basis, it seems to make sense to me that we put a mandate in place. And I think we should revisit it frequently, certainly at every, you know, every Board of Health meeting we have until we remove it. And I think we should set some clear guidelines for when we think we would remove it, which to me would be, you know, we'd have to see some of these numbers decreasing instead of rapidly increasing. I mean, 40% in a short time period quickly becomes doubling and tripling if that continues for a few weeks. So anyway, that's where my head is at right now, at least.
Yeah. Thank you. Yeah, and I'd have to say that, I've been conflicted all along because I really wanted it to be left up to individuals to do the right thing. And we were seeing that, but I think we might have passed that point. So I think the time for a mandate has come. And what I'd like to do is take a vote on that piece and then talk a little bit more about some of the parameters around it. Is that appropriate? Karen, you're good at keeping me on track, and Ray, yeah?
You can do it that way.
A quick question, Jill. Who would be reinforcing this? I read how Acton obviously have involved their police. So that's a question I have in mind.
That's always been a question. And that had been, when you look at our previous mandate, oh my God, the language it said, to the extent necessary, this order shall be enforced by the Director of Health and Human Services, hi Marcia, and others she chooses to empower as agents of the Board of Health. That's always been a question. And I think we can get into that when we talk about it in terms of the parameters. I want to just now get a confirmation whether or not to go forward with a mandate, and then we can talk about some of the logistics of it and what it looks like. Is that all right? Marcia, do you have something?
I just want to say that I don't think Concord has a Director of Health and Human Services. So I think directing that person to be the enforcement agent is directing it for no one to be the enforcement agent. I'm the Director of Planning and Land Management, so that's
right. No, thank you for that clarification, and that's a problem, but we'll get there.
It didn't say public health director, Jill?
Karen, and it's at the bottom of that. It should be Director of Health and Human Services and other, he chooses to empower as agents of the Board of Health. I have a big question mark written next to it.
Yeah.
I think that's taken from Acton. Acton has a different setup. So.
But none of us were reading it closely when we signed it May 8th, 2020. Okay, we'll get it better this time. Okay, can I have a motion to put in place an indoor mask mandate at this time?
I would move that we put in place an indoor mask mandate. Is that subject though to different conditions, or can we simply vote on that alone?
That's what I was asking, whether we can put it, whether we can talk about whether or not to have one, and then we put the conditions in place and the parameters. That's what I just wanted to get in place.
You can do it that way if you want to. Move forward with an indoor mask mandate and then put the conditions.
Okay.
Make a motion for the conditions, right, Mark?
Yeah, we could do that. Or frankly, I think
wait.
I think it's cleaner if we wait for the formal vote. And I think instead, Jill, you should just ask for kind of a straw poll to know if we've got the majority of the board moving forward to figuring out the conditions. Otherwise, it's a waste of time to do that.
Thank you. So glad we have an attorney on this board. Thank you. Okay, so just a basic show of hands then among board members, whether there's support for it. Okay, so we have 3 out of the 4 of us. We, Mark, yes, is that a yes, Alma? That you're okay with it?
Yeah.
Okay, so we basically have the ability to move forward with it. So the question is, I know that there's a lot of, when you look at the neighboring towns for mandates, some of them are really straightforward and some of them are very, very detailed. I heard Mark say that we put it in place for public spaces, but possibly leave it up to small business owners, small offices to determine for themselves. I know that it's really important to put a time frame on it. And I think just so that we don't have to scramble and do meetings, emergency meetings like this, we agreed to look at it at our next Board of Health meeting on January 25th, that it stays in place until the 25th. By then, the preliminary science is showing is that Omicron it looks like these are very quick and intense surges, and that possibly it starts to subside as more boosters get in place. We hope, but we would look at the data as closely on the 25th as we did this morning. Other parameters.
So on that one, Joe, I would just say, I think the rule should say until determined at the next Board of Health meeting, just in case for some reason the 25th ends up being a change date or whatever, right? So I wouldn't put a specific date
Right.
without it being the next Board of Health meeting.
Makes sense.
Jill, I'd like us to take a look at the Bedford's mask mandate. I like the language where they say that the mandate will be in effect whenever the level of community transmission data from the U.S. Centers for Disease Control from Middlesex County is categorized as high over a consecutive 4-week period. And then conversely, it would no longer be in effect when that data is categorized as low, moderate, or substantial over a consecutive 4-week period. So that we actually relied on data and the CDC's data.
I agree with using data as a marker, but what's interesting about that one is that, Middlesex County has been designated as high transmission for a really long time, even when Concord numbers were significantly lower and not in line with that. So that's where I've struggled with that particular metric, because we have, and even, when you put in numbers like high was a transmission rate or an incidence rate of like 5.5%, something like that. It was, I think, their designation. We're lower than that now, even at this very high level of reported data. So can we come up with a different one that's be more reflective of what we see here? Or do we want to have it based on the county designation? I mean, that's okay too. I personally, I'm not sure if that's the clearest metric.
And how about the question around the prison? Is that in the Massachusetts count?
No, they're not counted. I mean, those are reported totally separately. And the prison data, I did have as of the 18th, the case count in Concord was 81. No, excuse me. There was a total of 315 cases overall at that point that were reported as of 2018, on December 18th. And that did not include 14 new MCI cases. So they're counted very separately.
Right, okay.
We don't really get involved with that at all.
So we live in Middlesex County, and again, it's there are tourists. People are in and out of the town to work and shop. So that there is some validity of looking at Middlesex County data. Now, on the other hand, we might want to look at what the Department of Public Health, how they rate different communities, in their color-coded charts. Maybe that's a way of looking at it if we want to be more specific to the town of Concord, where, if we're in the red rating versus the green rating, that might have a bearing on how long we want to keep the mandate in place.
Mm-hmm.
I haven't seen that chart recently, and my guess is that we're not in the red rating, but that may offer some guidance, although.
No, I think you're right. I'm looking at that data now. I'm trying to find the case count or which chart. I mean, there's so many charts, and when you break it down by town, oh, here it is. Sorry, data by city and town. And this is right now Middlesex is sorry, bear with me. This is the blue chart, and sorry, still getting, my default for some reason is Barnstable, not Middlesex. So right now we're in the light blue, which is relatively low. This is where the 14-day average incidence in Concord is 30.9 per 100,000, whereas in really high levels within the county like Draycote, it's 103.8. This is why county data is just so challenging, I think. But the town shows up in the light blue. Maybe when it gets to the white, which is where Lincoln is, and Winchester, strangely, they're the only two towns in the county that show up as white.
Interesting.
Sorry. I just, I'm having a hard time finding the right metric. And I wonder, Kathy, whether you have any, any sense, since you're looking at that data all the time, what might be an accurate one? Not to put you on the spot here.
No, that's fine. I'm not actually looking at this data all the time. So Trish and I are really just so focused on our towns that we cover. And so I don't even have time. We're so inundated with case investigation and calling these 171 cases by ourselves because the contact tracing collaborative ended December 1st.
Mm-hmm.
So we're not looking at the wide data, but I have the same screen pulled up. And for some reason, it also defaults me to Barnstable County. So I think that's a general.
Okay, good to know.
Yeah, yeah. So I can take a look around and let you know what I can find here. But I have access to the town case by case in the town, but that's really all we're so focused on right now.
Right, and I don't know if the case count is an accurate one, because maybe it's a number of new cases per week. Maybe that's something that is more reflective, like a change in the 14-day positivity rate.
Yeah, the cases I gave you were, I ran the reports for the cases, week to week, starting December 5th.
Mm-hmm.
And so it went from 39 to 48 to 79.
Mm-hmm.
And that's just Concord, and obviously they're Concord residents. So,
right. I wonder if because of the challenge right now, as we said, with testing data not reflecting home tests, whether if we were to look at the 14-day average daily incidence rate, and we have a number as of 12/23, which is 30.9 as an average incidence, which is number of its new cases, it's the average incidence rate. And I wonder if we're looking at that, whether that is an indicator of changes in new infections. So if we have right now an average incidence rate of 30.9, this is actually as of 12/18, whether we look to see that metric really go down, to always be looking for a downward trend as a metric for how long this mandate stays in place, which is, I don't know.
Well, I think that's interesting. What's this kind of, do you have the data, like a trailing, the last few time periods?
I do. So 14-day average incidence. I have to go into the chart and into the DPH website. I have a 14-day positivity, which is a little different. And that was the positivity based on number of cases, not necessarily number of positive cases. I'm not explaining incidence and prevalence accurately there. 14-day positivity is different than 14-day average incidence. But what was happening, actually, forget I said any of that. Okay, because I have handwritten notes. Don't pay attention to that. And then I have other notes. So I'm just tripping myself up with all of it. But the trend has been going up, Mark. That's the answer.
Yeah, no, I agree. The trend has been going up. I guess I'm liking your idea. The positivity rate is sort of an easy one, but I understand what you're saying about it being incomplete because of home tests.
Mm-hmm.
I think you're right that actual case count is even better, because frankly, positivity just has to do with how many people get tested or not, right? The more we have pool testing of healthy people, the lower the rate is. So like our school testing brings our positivity rate down just because we have so many people getting tested. So if we did it on actual case counts, I like that idea. And I like setting, I think no matter what we do, it should be revisited at every Board of Health meeting regardless, but I do like having an automatic sunset that we've sort of agreed, okay, if we get to this point, we can sunset it, while still, strongly recommending. And I was just trying to get a sense of what those numbers were to see what the right baseline is, right? So if we're at 30 now, is the baseline when we get below, 15 cases a week, or, what's the right line to draw? Because I don't think it's just when we're declining. I think we want to be declining, not just 1 week, but, continuing declining, or at least being plateaued at a lower level than we are now. And frankly, if we were at the level we're at now and it wasn't rising, I don't know if we'd be having the discussion, right? So, it could be that that 25 is the right number. I don't know what the right number is, but it's the fact that it's increased and it's going to continue increasing for the foreseeable future that, makes me feel like we need to do this.
Right. So here's some information for you. So 14-day average daily incidence on December 2nd, it was 18.3. On December 9th, it was 19.1. By the 16th, it was 25.9. And on the 18th, it was 30.9. So 12 to 18.3 to 30.9 by in 21 days.
Yeah.
So
Jill,
so
were those
without
actual
a better number to pick, just hearing those numbers, I would consider, setting a mandate that says it'll automatically, and it's maybe not even go away, because if the rates go back up again, we'd want it back in effect, right? But it would sort of automatically pause whenever whenever that number goes down below 20, right? That sort of feels like the right level of, where we were when we were comfortable that, our town's in pretty good shape and we don't necessarily need a mandate, although we strongly encourage masks, versus, where we are now, which feels like we're in the middle of a spike, and hopefully we're at the end of the spike, not the beginning of the spike, but we might be in the beginning, which is why we're doing this. And so yeah, I don't know, just hearing those numbers, that feels like a good place to set it. And of course, we're going to revisit it every Board of Health meeting while it's in place. And therefore, if we decide a few weeks from now that it's a different place we should set it, we can always change that. But that sort of feels.
It sounds like, one problem will always be a time lag in having accurate data, but I think we're kind of probably in the middle of a spike right now because of the holidays. It's going to just, keep on growing is my guess. But it just seems like it's kind of the best information we have to go by,
But I also think Omicron is only very new to the scene here. And so I think there's a good chance we're holidays or not, we're at the beginning because of it, right? That's again, probably if it wasn't for Omicron, I wouldn't necessarily be saying, let's do this. But I think there's so much unknown still on that I think it's just the prudent thing to do for the reasons Ray said, right? Kind of better to be preventive and do no harm than to not do it and wish a month from now we had done it.
Right. So do we set the metric then as when the 14-day average daily incidence is below 20%? Is that where we feel comfortable? And that would get us back to pre-December levels. Karen?
So, yeah, can you repeat what you just said? Is that actual cases or is that? the
Cases,
measure?
yeah, not percent, right?
14-day average daily incidence, which is the number of new cases divided by the number of people living in Concord.
Okay, 14-day average daily incidence.
So that's
At
basically,
20%.
yeah, below 20%.
Below 20%.
Isn't it below, isn't it 20? Isn't it?
Well, below
or-
20%. We had it at, we have, right now we're at 30.9%. As of December 2nd, it was 18.3. We did not have a mandate then. We didn't have one we haven't had it at all, obviously, but it was 18.3, 19.1, 25.9. Now we're at 30.9.
Yeah, so until it goes below 20%, and then it would be paused when it was below 20%, and if it kicks back above 20%, it would be back in effect again without us having another emergency meeting again, unless we at a subsequent Board of Health meeting have made this go away, right? So
Right, or maybe there's other information we have at that point, you know, that, maybe at that point, you know, the rate of people that have been, you know, vaccinated with 3 vaccines, you know, goes up at that point. You know.
So we selected 20% because that was what we were comfortable with, having taken no action. Is that right? It's really not based on any kind of science.
no, right. It's based on, yeah, I fully agree, Ray. It's a little bit of gut based on the numbers, but it also would mean it's a 50% decline from where we are now.
Right.
Right. I mean, it does feel a little arbitrary, but I just don't, I feel like they're all, I don't know what else is more accurate in doing it. That's my challenge.
Yeah. And again, I would also say, I mean, this is an emergency meeting. You know, I'd love to have Dr. Green's input too on these. Like, we can revisit what we set this at the next Board of Health meeting. I think for today, it just feels to me like that's as good of a spot as any to say, hey, once we're, you know, drop a third from where we are today, you know, that's a good place to say things have stabilized, right?
Well, I like this whole methodology. I only wish that there was some data point or something that we could cite that says at 18 or 19 or 20, we're comfortable with, removing the mask mandate. Other than the fact that we were comfortable at that point not imposing it as the rationale. So, but I would be comfortable going forward with this.
So do you want something in addition, going back to the CDC designation? So, you know, in addition, you know, or in either or scenario, if the CDC designation goes from instead of high down to substantial, I think that's the next level.
Right.
That automatically triggers a removal. Or
yeah, I mean, I'd like us. Yes, I think that makes sense to perhaps have two standards. But I do like the idea of relying on, the CDC and the science there, in addition to what we feel comfortable with as a trigger points.
So that then speaks to both. That, you know, if the 14-day average daily incidence drops to below 20, or the CDC designation goes to substantial from high, then the order is rescinded.
Right.
Well, halted. Just because I want it to automatically be back in place if it flips back again.
Okay.
Well, but to that point, I think we should include that language saying that it would be reinstated or taken off halt and reinstated should those data points change.
Goes back into effect.
Yes.
You're muted, Karen.
Somebody needs to say it slower because you're going back and forth too much. Mark's going to have to go very slow when he gives his motion.
You ready to do that? And we can still talk about some parameters about how it happens. Is this the moment?
I'm not ready to recite it, at least.
Okay. So do we want to get into, okay, we at least have 2 metrics in place now. We got that far. In terms of specifying where it's in effect, our previous order went into great detail about it was members of the public entering any business, worksite, or government building. It was about all food establishments, all businesses when interacting with the public, food, and then we had the whole section about people walking sidewalks, bike paths and trails. I don't think we need that at this point. There was also, we had specifics about the Concord Housing Authority. I don't think we need that. We had retailers that we were limiting the amount of people in shops. I don't think we need to do that anymore. Extra staffing, reusable shopping bags. Those are all part of our previous mandate. And we've since learned a little bit that that was perhaps being overly cautious, knowing what we now know about it. Some of the other towns have, there were a couple of really straightforward ones. Like for instance, Acton, all members of the public entering any public business premises, including but not limited to grocery stores, pharmacies, retail stores, and the like. And then it goes on to food service, and then it goes into public municipal buildings. Do we need to get specific, or is there a way of being comprehensive and concise? Ideas? No?
Just looking at
Lexington's maybe was.
well, somebody a few examples.
I thought Bedford, I like Bedford's going back to, you know, the third paragraph in Bedford's where they talk of all indoor spaces, houses of worship, private spaces open to the public, and excludes private residences, of course. I thought their language was pretty comprehensive. I think offering direction as opposed to being vague, which then opens to interpretation, and I think it's more problematic. But I also thought Lexington provided a rationale for why the mask mandate was being imposed, and I thought that made a lot of sense. This is the reasons why we're taking these actions or this action at this point in time.
I think Sudbury did that as well. I have all these things. Okay, so you're saying the Bedford one, which, yes, so required for all individuals aged 2 years and above in all indoor public spaces, houses of worship, private spaces open to the public, or where individuals from different households can gather except where an individual is unable to wear a mask due to medical condition or disability. And then it goes on to be specific about the schools, which have their own different guidance that they follow. I agree that I like the simplicity of that and the straightforward nature of it. It seems like we don't have to go that much further. I would, all indoor, well, that's the question. All indoor public spaces. It does go into it, describe that being fitness clubs, health centers, lodgings, personal service establishments, etc. Do we need to get into that level of detail? I know that the Carlisle mandate does not, but then again, Carlisle probably has very, very few public spaces beyond the schools, police station, library. I don't know. Lexington, what does Lexington do? I don't see the description. Is there agreement that we want it very straightforward, basically just saying all public indoor spaces? Just show of hands on that one.
Yeah.
I think we want it straightforward, but I also, if I'm looking at Bedford, I think it's pretty thoughtful about exceptions, right? Like the, you know, the exception for when when someone's getting a facial or getting their beard trimmed or something, right? Like,
Mhm.
I'm all in favor for the simplicity, but I don't want to, cause someone to have a foot fault for something. I mean, we're not trying to tell barbers they're not allowed to trim anyone's beard anymore, for example.
I think I would agree. I think we need to offer some degree of guidance.
Okay.
And I felt that Bedford's had provided the right balance in that without going too far. So I like that. I don't think some of the I think some of the latter parts of theirs, number 10 and 11, pertain to the schools. I'm not sure we need to do that. And I also think that we have to provide some guidance to businesses with signage models, so that they're not inventing it themselves, but that they're a standard signage model that we can provide to businesses to post.
Okay. I would agree with that. And I think when you look at the list, I mean, even the school ones that you cited, Ray, I actually don't have an issue with. It says all Bedford private schools are required to follow the American Academy.
Oh, sure. Okay.
And then the other one, Bedford public schools, when used for non-school activities, are subject to this.
Okay.
mandate.
Yeah, that makes sense.
Yeah, I think those are okay. And I think that maybe there needs to be, and actually their introductory paragraph, if we were to adopt theirs as whole, talk about the different guidance that schools are required to follow through the Department of Elementary and Secondary Ed. And I think that's appropriate to include in this. I know that there's plenty of examples out there about what, the signage looks like. I'd say if we're looking at Bedford as the model, and I for simplicity, I think why reinvent the wheel? This gets to Alma's early question and the challenge we've been up against all along, which is this enforcement. The Bedford Health Department staff, to the extent necessary, this order shall be enforced by Bedford Health Department staff as agents to the Board of Health. So we know that we are an understaffed department, which we don't have the capacity to respond. As Susan was always saying, we don't have SWAT teams able to go out and, find somebody for a mask. I know that in the beginning, we talked about the very beginning, we were able to deputize the police department to enforce this. We also know that, not all policemen are in favor of mask wearing. So there's some issues right there. We don't have the ability to enforce it. It just, so that's always a concern. How do we make sure this happens? And I struggle with that. And I think that was part of why we haven't always put this in place when we heard earlier concerns for having it. So I continue to struggle with that.
Yeah, I think those are good concerns, but I think at the end of the day, it is what it is. I mean, we don't have a police officer at every stop sign making sure people stop or speed or whatever. Like at some level, I think we have a very responsible community. We've held off on having a mandate because we have a responsible community and we felt that in general, people will do the right thing. I think if we have a rule and people know what the rule is, more often than not, they're going to follow it. And more so than if we don't have the rule. So I think, whether or not we have perfect compliance, it's going to be much higher compliance than just our suggestion that we have now. And I think I would sort of leave it at that and see how it plays out, recognizing that, if anything, it gives the store owners a little bit more to stand behind when they tell people, no, you have to have a mask. It's not, it's not our fault. It's the Board of Health's fault. They can say now, right? And so that in and of itself, I think, is worth something as far as getting compliance and having people comfortable. Now, I think what would be horrible is when you have a little bit more of the vigilante enforcement, right? I mean, I think that to me is a little bit of the concern at one point, as between the balance of people doing the right thing and then people in the public sort of, feeling empowered to scream at their neighbors that aren't wearing a mask or whatever.
Right.
But I don't think we can help that. And I think if people are going to be like that, it's probably going to happen whether or not we have a mandate anyway. So anyway, I think they're good concerns, but I don't think it's a reason to not do it. And I'm not sure there's anything else we can
Right. I mean, I wasn't suggesting that we would not do it because of that, but I just put it out there as something that it does concern me. And, but I don't think there's really much we can do about it. We're just, no matter what we do, we're gonna be faced with.
You know, I think as a Board of Health, we have a responsibility to provide guidance to the general public. And that guidance is based on science, based on evidence, based on facts. And I think that there will be a high degree of compliance in a community like Concord. But I think it's our responsibility to provide that leadership and put the guidance out there, then for people to use to their advantage.
Right. I would agree with that. Right. We can just hope that people, as they have been, will do the right thing, and people largely have. So I would not have any wording in this about enforcement, just because we can't. Karen?
If somebody has their hand up when you're ready to take
Yeah.
comment.
Thank you. I did notice that. I'll get there. Okay, so if there was any, actually, Cynthia Rainey, please go ahead. And if you want to introduce yourself
Yeah,
officially.
I just wanted to, and I think also we have to consider there's a special town meeting coming up January 20th, but the schools already require masks during school, after school, all visitors. And you have a regional school district. So just to consider that, because we're an entity on our own. So I think you can remain silent on the schools, and I would expect that we would certainly not remove a mask mandate before the town of Concord, and I'm just speaking for myself. So, you can all do it, but I think we're in good shape at the schools during and after and before. And I think I'm not 100% sure, but I was concerned that Carmen was going to allow unmasked attendees to sit in a separate area. So I think this would cover that situation, and we would not allow anybody to come to a special town meeting unmasked.
Mhm.
So that's my input. The cases at the public schools have risen fairly dramatically, I would say. And I could not give you statistics on how many of those were vaccinated versus unvaccinated, but I think the majority of them are vaccinated. Yeah. So we are going to reinstitute, or Superintendent Hunter is maybe going to recommend we try to distance 3 feet at the schools where possible.
I'm sorry, what was that last thing you said? That they're going to what?
To try to distance 3 feet.
Oh, okay.
And we did not have that in place, so.
Okay, but reinstate that, which was in place in the beginning, is that right? Or was it even further?
I don't know if we had it in place this year, to be honest. I think we were sort of softly trying to do it, but I don't think it's certainly not a policy.
Can't be easy with those little kids.
No. But they're
no.
getting vaccinated, some of them, so.
Right.
It's, yeah.
Right. I mean, the good news is I do see that the rates are climbing in children, but the DPH data is just showing not serious illness among young children, or not hospitalizations and no deaths, thankfully. So.
Yep. Very good. Thank you.
Thank you. Okay, so we've covered the metric for rescinding or for pausing it. We've covered enforcement. We've covered locations. Is there anything more that has to be articulated at this time for what the mandate would include?
Jill, I would appreciate if we could hear the words from the Bedford mandate in regards to the public buildings. What is listed there?
So the early, without getting into full detail at first, it says face coverings are required for all individuals aged 2 years and above in all indoor public spaces, houses of worship, private spaces open to the public, or where individuals from different households can gather, except where an individual is unable to wear a face covering due to medical conditions or disability. This excludes private residences. And then it goes on about the schools and their own licenses. Right. But then it goes into details about food service establishments, lodging, fitness centers and health club workers, personal service establishments, public transportation, which is currently covered by statewide mandate.
Right.
Residents and employees in multi-home units, multi-unit homes and apartments are required to wear face coverings when inside common hallways and spaces. Members and employees in private membership clubs are required to wear face coverings while indoors. It says all entry doors of businesses open to the public must be posted, to Ray's point about what they have, what about their masking, and then school orders. So it's
Okay,
pretty
thanks.
comprehensive.
Mm-hmm.
Cynthia, your hand is still up. Did you have something else to add, or is it just a vestige? Guessing it was a vestige. Okay. Do we want it to be as spelled out as this Bedford guideline? I actually don't. I think it's a pretty fair one, as Ray had said earlier. Okay. Okay. Is there, so we have our metric, we have our timing, and we have our details. Is there anything else that needs to be incorporated into it?
The only thing I would add is that Lexington does a really nice job. They have about 10 different points that they use citing data, and it's all footnoted, and the citations are provided. So it really does provide to the reader, a very strong rationale as to why, based on the science, we're taking these steps. There's a reference, a brief reference in the Bedford one, but the Lexington does a very nice job of providing the citations, should people want to look at that, for the reasons why they've taken that action. And that goes back to August 10th, and obviously Omicron has changed the data, but quite a bit of it would still be applicable should we elect to do that, and perhaps it needs to be slightly updated. But I like the way that they've provided that rationale.
Yeah, I'm also looking at Sudbury's rationale, which I think it, oh, it's interesting, which has a lot of the CDC citations and fluctuating fluctuating data. It's interesting. It says their final paragraph is, it's interesting. We are closely following the COVID data, which will eventually recede again, and will rescind the mask mandate when the data implies it's safer to do so, as we did before. The board voted to utilize a low risk classification for 2 consecutive weeks on CDC Middlesex County risk levels map as the sole metric to rescind or modify the mandate. So we were saying substantial as opposed to low, because substantial is where we had been before, or substantial brings us down lower than what we are before. But it's interesting that, Sudbury, is this Sudbury? Yes, Sudbury is looking to go even lower to reduce theirs.
Yeah, but I mean, I think this gets to the point before, though, that Middlesex County is not the same as Concord, right? I mean, if we had a specific metric for just Concord, I think we could use that, but we don't.
Right. I would agree with that, because it's not the county. So, so Ray, I mean, there's a lot of different rationale data that we could include. I'm just wondering if you want to take a stab at looking and seeing what's the most helpful, appropriate, because when I look at these two, both Lexington and Sudbury, there's a lot there, and I just wonder if all of it is necessary. I mean, I could look at it too, but
why don't we both look at it, and probably all of it isn't necessary. I think providing some rationale, though, I think would be helpful.
I think I would agree, but there's a lot. So let's both take a look at it offline and come up with some, concise bullet points for somebody to follow.
Yeah. So I have a procedural question. I realize I'm the lawyer, but I don't know this area. I mean, it's very hard to draft a mandate in a meeting like this, and we can't, talk about it separate from this and I don't know how long it would take to do another meeting, is, you know, for most meetings, you're able to adjourn a meeting for a certain time period, right? Like take a break for a few hours or something and reconvene in a few hours. And I wonder if it doesn't make sense to sort of, you know, pause this meeting for a few hours and, you know, give each of us whatever homework assignment we have to have a, you know, to basically come up with a draft that we then reconvene the meeting to approve. But I don't know, Karen, has anyone ever done that for any of these meetings? I mean, I know in corporate law, that would be a normal, like you can do that. It's pretty easy. It's basically take a break and reconvene.
I can honestly say I don't know the answer to that question. I would have to ask the town. I can find out quickly. But John, I can find out quickly.
I'm wondering though, if it's really essential outside of what Ray and I just said we would do in terms of providing the background information, which isn't the mandate, it's just some background, whether if we were to work with basically what's in Bedford's with the addition of that, the metrics.
So you're thinking the background won't actually be in the mandate. It will be like in what gets posted on the website as
That's
the
what I was
content.
thinking.
Okay, that works.
Yeah, as opposed to interfering with Karen's vacation and everybody else's holiday week, you know.
Well, that's certainly fine with me. I have too much other stuff to do, but even Bedford's, I think we have to kind of go through line by line and tell you what to change, Karen.
I agree with you. And in Bedford, I don't know if it's on that second page, Jill and Ray, how it does have links to the level of community transmission and does that not address some of the things you were talking about, Ray? And then the other things we could just post on our website, on the COVID-19 website. Those other.
I think that's a solution. I do think we have to certainly modify Bedford in a couple different ways, but
I mean,
that
I'm
might help.
here now. I'm not going anywhere today.
So, and I think that the suggestion that we post on the website, the rationale, would allow us to move forward with this.
Right, because I think there is a level of urgency that we want to get this in effect as soon as possible. That's what we're hearing.
Right. No, I agree with that. Is there a way for someone to show the Bedford one on their screen and for us to edit it real time as we're on the Zoom?
I can probably. I can do that actually.
Can you do that, Jill? Because my
I
laptop,
have it up, so let's see if I
my work
can.
laptop won't let me do it.
Let's see if I can do it. So there's my mask mandate. So let me see if I can. Wait, just lost it. Share screen. Maybe not. I have maybe too many windows open. Portion of screen. Let's see.
I'd be interested to hear about the citations and if it spells out fines. Ray, does it go into any of that?
Bedford
Well,
does not.
the fine, I think
Oh,
the
it does.
stated fine is $300. Isn't this a civil? This is a civil issue, so it's a $300 fine for violation, isn't it? Or is that correct, Karen?
Well, that's what it says in Bedford. I have to go back and look at ours for
What was ours? Was ours?
Concord.
I don't think we had a fine in place. The Concord one, I have it.
Yeah.
We did not.
Can we leave it at that?
I would like to, because it gets back to that enforcement challenge.
Right, exactly.
I don't know if I can share. I have to probably close a lot of things. Let's see. Let's try this.
Gabby, can you show yours? Can you open your link? I can't open my laptop.
Um,
Jill, I'm gonna step off if that's okay. I just have a lot of people to reach for contact tracing.
Okay,
Is
well,
there
thank you so much for helping us out today.
Kathy.
Okay,
Appreciate
thank
you.
you.
Thank you.
Take
you.
care.
Good luck with it.
Thanks.
Oh, is that showing up?
Yeah, Gabby, yep, there you go.
Oh, good.
Oh, you did it, Gabby. Thank you. I thought I did. I pressed
You
something
can
and it
take credit
happened.
for yourself. It's okay.
Laura Levan, if you want to speak now, please.
Thank you. I just, Laura Levan, 58 Nimrod Drive. When you get to the wording about fitness centers, my particular interest is the BD Center pool and what you're going to do about that.
Yes, and I know that's a concern and it hasn't been forgotten by me. And we're just talking about masks now. And
No, but I mean, masks cannot be worn in the pool. So
Yeah.
are you going to address that at all? Or that's my only question.
Yeah, I'm really challenged as to how to address that. This board has made it known that we recommend to the town to check for vaccination status among all BD users, and it is no longer in the board's hands. It is the town's decision how to act on that. And because masks can't be worn in the pool, I hesitate to add it into specifying it here.
Okay.
But the board has made that recommendation to the town based on our last conversation.
Right, but I think she makes a good point though, Jill, that if we're not specific when we talk about fitness center, right, the Bedford language is specific about fitness centers. If we don't specifically put in something that says, except when you're in the pool, I think that basically means we've shut down the pool, which I don't think is our intent either.
Mm-hmm. Yes, so I would, how do we modify that statement, which is right there, number 4, to both reflect our concern and the limitations?
Well, I think we can say something. Obviously, you're not going to wear a mask in the pool, but you would be required to put the mask on while on the pool deck.
Mm-hmm. And
I think we could talk about distancing while in a pool too.
Mm-hmm. Okay, so a sentence.
But I don't think although we're encouraging it in the BD Center to make the rule, I don't think we're talking about making a vaccine required rule here. This is just about masks. I think we open a whole nother can of worms if we try to legislate vaccine exceptions.
Right. And we've made that recommendation. So I think we can expand on this sentence to say, including, let's say, required to wear face coverings during fitness activity, including strenuous activity and while on the pool deck, and in locker rooms.
Mm-hmm.
No, I'm sorry.
Point number 4.
Okay, yep.
Just add, including strenuous activity and while on the pool deck and in locker rooms.
But then we'd say, but not while in a
Not
pool.
while swimming.
And then does that mean getting involved with other pools in the area? Why zero in on one?
It's not zeroed in. It's not specified here.
Okay.
Yeah, that would apply to any public pool, right? A
Right.
private pool wouldn't
Right.
apply,
But fitness center and health club workers, of which, but there are 2. Presumably the pool, I don't know if there's an indoor pool at any of the schools. I don't think so, but they'd be under the DESI guidance anyway. Actually, I don't know about private schools.
Mm-hmm.
But I don't think we have to I don't think there's any indoor private pools. I mean, indoor pools at the private schools.
There's one at the Thoreau Club, one at the Marriott Hotel, one at New England Deaconess.
So does this cover it for those, Gabby, as far as you?
Well,
Good.
New England Deaconess, yeah, I think this would cover it for them. I think it would be appropriate to just like you would do for the restaurants, where it specifies, except when seated, you would do something similar for pools, and social distancing should be followed.
Mm-hmm. So, so adding to point number 4. So it is recommended that pool users social distance, and what was the other thing you said?
Remove masks only when during activity. So it would follow what the food service would do.
Okay, so fitness
So
center
you-
health club users may only remove their mask during when swimming.
Mhm.
I think it needs to be very more specific. I mean, the CDC doesn't recommend mask wearing when swimming. You can't.
Why can't? oh. Seated. Why doesn't that cover it, Gab, while on pool deck, locker rooms?
It
And then
does.
Just, oh.
You're
not
just
while
saying to expand upon it, social distancing measures should be maintained, or
Correct.
something like that.
That's
Okay.
correct.
We recommend social distancing measures be maintained.
Right.
Going down, is there anything else in terms of the parameters of when it's in effect? Then we need to get into, yeah. Going down, this whole, can you show us that whole second page, Gabby, please? I think we take out that sentence, to the extent necessary, this order shall be enforced by the Bedford Health Department. I don't think we have anything, I don't think we can put anything in here about this, or can we?
I mean, I think we have enforcement authority. We just don't have the resources to actually do it. So I don't know that I would
You could leave it in there.
take it out. I would leave it in. I just practically speaking, we're not going to send people to, we're not doing inspections here, right?
Yeah.
But I do think we of course have the authority to enforce it, right?
Mhm.
And I could imagine a situation, if there was a particularly egregious situation, I could imagine in some setting that being possible, even if we're not generally enforcing things, right? So.
Mhm. Okay. So we can leave that in, and then that next paragraph, though, is like, I don't know how to respond to that one.
The fine.
Yes.
Yeah, I would leave it in too. I mean, first of all, it says if after a verbal education and written warning,
Mhm.
and then it's up to $300, right? That doesn't mean we have to fine anyone anything. Again, I think that the likelihood of enforcement is low. But if we found out that I don't know, the BD Center had some big massive party, I mean, it's not going to happen, but you could imagine situations where there would be a reason to have enforcement, even though I think it's unlikely.
Karen?
I think that's in, is that non-criminal disposition violations Bedford specific? Or is that us non-criminal code for like that's mass general law, right? So that.
Yeah, that's mass general law. So
Okay,
I
so we
think
don't have to worry about specific amounts, right? Okay.
Yeah, I think that's just giving us authority to do it if we ever need to. So I think that can stay.
Okay, so then
But I
moving
think-
down,
Yeah, I think this is where, and maybe we need you to repeat the, that 14-day average 20% that you articulated before.
as if I can. Let's see, I have a lot of paper here. Karen, did you capture that when we said it early in the meeting? We said that when the 14-day,
This is what we said.
we said the 14-day average daily incidence.
14-day daily, yes, the daily average incidence below 20% and or the recommendation and or CDC recommendation guidelines go from high to substantial.
No, so when the
Substantial to
CDC
high.
level of community transmission for Middlesex County is
I thought we were
designated
using that.
is when the CDC level of community transmission data for the town of Concord is categorized as substantial.
Right, we got to change. I got to change that.
But I don't think this, whoops. I don't think the CDC has breaks it down. Does the CDC break down data for Concord alone?
No, I don't think it does. So I think
So I
I think-
can't use that.
That's
Yeah,
DPH data.
the
That's
change,
DPH data, yes.
right? So the change is, so in the first one, we say this mandate will be in effect whenever both Roman numeral 1, the 14-day average incidence count, if that's the right phrasing, 14-day average incidence count for Concord is at or above 20%. Or,
At or
no,
below.
first we're saying, when is it in effect? And then we say, when
is
is it
at or above.
no
Okay.
longer, right? So it's
Right.
in effect if it's at or above 20%.
Right, and it's the
Or-
phrasing is the 14-day average daily incidence.
14-day average daily
Incidence.
Incidence for
incidence.
Concord
Yes,
is at or above 20%.
Yeah, or Roman numeral 2, the level of community transmission for Middlesex is high, so.
no,
Community transmission.
Yeah,
For
that, for
Middlesex
2, I would
County.
do, right, for
according
2, I
to
would do what they already have here, right? So just say
according
this-
to MDPH is considered substantial.
According to MD.
No, that doesn't,
That's the category they use in those charts? The word terminology is substantial.
I have to get into my screen. How do I get out of Gabby's screen?
or 2 level commu,
I can't get into it now.
So are we trying to have a different test than the Bedford test? I thought we were doing the CDC for Middlesex County, but as a second.
I thought so
and either
too.
or. So we don't need to change the way they did that piece.
that's there already. That's why I
Yeah.
was confused.
Right. So again, let me just repeat and then people can change it,
Okay.
but basically in this first paragraph, right, where it says this mandate will be in effect whenever, and then I would insert the phrase both Roman numeral 1, the 14-day average daily incidence for Concord is at or above 20%, comma, or Roman numeral 2, and then just continue the rest of the sentence, which would be the level of community transmission data for the U.S. Center for Disease Control, CDC, for Middlesex County is categorized as high over a consecutive 4-week period. I think that would be the first, that would be that paragraph. So I guess questions or changes on the wording for that paragraph before we go to the next one.
I need to hear the next one before I can comment.
Okay, well, the next one would be the opposite of this, right? It would say, this mandate will no longer be in effect whenever, and then I would add in the phrase either Roman numeral 1, the 14-day average daily incidence for Concord is below 20%, or Roman numeral 2, and then continue the sentence. So the level of community transmission for Middlesex County is at, low, moderate, or substantial over a consecutive 4-week period.
Mhm.
But do we say MDPH instead of CDC? That's what you mean.
in
'Cause
the,
they say CDC and Ray said, and Jill said MDPH.
I think for the first part of it, it's an MDPH metric that we're talking about. The 20% is an MDPH metric.
But I don't have to, we don't put that in, we don't have to put that in the words, right?
No, you have to remove though, well, the mandate will be in effect whenever the 14-day average incidence is, and you're getting rid of the sentence about level of community transmission data from the
Yeah.
US CDC.
Yeah.
Oh, so we are, I thought it was gonna be, we're
It will
both,
be number 2.
But-
This is what Mark said. This mandate will be in effect whenever both Roman numeral 1, the 14-day average daily incidence for Concord is at or above 20%, or Roman numeral 2, the level of community transmission for, wait a minute, level of community transmissions from Middlesex County is considered substantial over a 4-week consecutive period, right, Mark?
well, so two things, I said or, but it should probably be and, because I was saying it's both of these. And I thought it was when it's high for Middlesex County. I thought what we were saying was, you know, we're gonna have this test. If it's both of these things, the mandate's in place. If one of them goes down, we're taking it away. That's what I had.
Okay.
That's what I had heard the discussion before. That doesn't have to be what we do, but that's what I had heard as the discussion. And I think on the 14-day average daily incidence for Concord is at or above 20%. If that's reported to us by MDPH, we can add that phrase. We could say as reported by MDPH. If you think that's appropriate.
I think it's helpful only because it's a standard that is everywhere in the state. I mean, it's, you know, it's not necessarily the most accurate in the absence of the home tests, but it's kind of what everybody is using as a standard.
Well, but DPH is the only one issuing those standards. So I
Right.
think it should be listed.
Mhm.
Yeah.
Right.
Okay. So Karen, for what we had already said, after we say at or above 20%, we would just add the phrase as reported by MDPH.
So like when I go in and if we, all right, let's finish and then I'll say my words. It's fine.
Okay, so we have the second two. That last sentence paragraph is accurate as far as I can tell. It reflects what we just said.
About reviewing at every subsequent meeting. Yeah.
Yes.
Mhm.
And basically assume that it's in place if we haven't done anything.
And
So are we on to the second, the second to last paragraph, the mandate will no longer be in effect, or are we comfortable with that language as it's written?
I thought we changed it.
That on that one, we changed it to be whenever either Roman numeral 1, the 14-day average daily incidence for Concord is below 20% as reported by MDPH, or Roman numeral 2, the level of community transmission data, et cetera, the rest of the.
Yes, but I guess the question I'm raising is that it seems to be a bit ambiguous here because it's either low, moderate, or substantial. And they seem to me to mean different levels. So do we pick low, moderate, or substantial?
Well, we could change it and we can say is not categorized as high. I mean, that's really what it's getting at.
Right.
So,
Yeah.
And that's really what we're trying to say, right? We're saying, look, when both the county is high and Concord is above 20%, this is in effect. And when that's not the case, it's not in effect. Now,
Right.
if Concord was at 50%, but the rest of the county was great, and so the county wasn't high, would we still think this was the right answer? I don't know. I mean, that's where the county part of it is sort of a.
Well, we
even
may
though
or we may
talked about
not,
including it, I don't know if it's really relevant.
but we certainly could look at that one if the time comes
Mhm.
to do that.
Yes.
The only, I think the language reads, it's a lot clearer now. The only question I have is going back to the 20%. So we used the benchmark or the starting point at 18.3%, and then we simply rounded up to 20. I would be more comfortable leaving it at 18.3% because it's at least a data point as opposed to rounding it up. Why? What's the rationale?
It wasn't rounding up, right? We had 18.3 like 4
And then
weeks ago, and then we had
19.1.
19.6, and then we had 25 point something, and then we had 30
Right.
now.
Right.
Right? It was more, to me, it was more a significant decrease from the 30% we're at now. Whereas I think saying, 18.6 or 19.3 is a little bit of false precision. Also, I mean, I fully agree. We're just picking a line that seems at the right place. And if someone thought 19% or 23% or something else was the better number, we could do that. But I think it's sort of consistent with where we were comfortable and now where suddenly we're not comfortable.
Right, but we were comfortable at a data point of, was it 19.1? I mean, I don't know what that corresponds to in our meeting, but it feels I'm uncomfortable with simply picking a number as opposed to tying it into some point in time.
We were comfortable with 25.9 at our last meeting. So 20 gets it lower than that. And it is somewhat arbitrary, but it just seems reasonable.
I also maybe this is a reason why we have the county test also, Ray, that you had added, because basically we're having the county test like Bedford is, but we're also setting this other test that says, look, if Concord's below 20%, then we don't have to have this in place, right? Even if the rest of the county is really high. And so, I think if you have ideas for a different percentage, we could do that. I also think people can think about this between now and the next Board of Health meeting. And it's an easy change to just change this percent, or even to change the metric altogether if we decide there's a better metric for the town. But I think for something we're going to put in place on an emergency basis, it feels like that's as good of a metric as any.
Mhm.
Okay, fair enough.
Is there any?
So, I was just gonna ask Jill, so if this is gonna be a new mandate, right? Or is this isn't considered an amended mask mandate, is it?
No, this will be a new one.
All right, that's what I thought, Mark. Okay, thank you.
Yeah, because there are differences from the previous one. So it's not a matter of just, updating the date on it. It was that one was written pretty early in this process when we didn't know a lot. So I do think a brand new one is in order.
So Karen, I think I can email you, not to everybody, but to you, like notes on what I think we just did, right?
Yeah, you can. I'm
gonna email you it's like a track changes of the Bedford one.
okay, that'd be awesome. I was gonna say,
Not-
I will do that as well, and then we'll incorporate.
Yeah, and then compare
That'd be
notes.
awesome. And then I'll send it out, and then we can you have to make a motion on the word. It's really just the edits.
That we have to make a motion
The
now.
motion, I think you have to make a motion. No, the edits are what you've been talking about. You have to make a motion on
Acceptance of those edits.
Well, I think it's not the edits. It's we would make a motion to adopt
adopt.
mask mandate as described at this meeting. Right. And what was
Yes.
described at this meeting was we're basically taking the Bedford one, and these were the changes we made to it to make it our own. The other changes are really, changing the dates up front I would have this be effective as of, 12:01 a.m. tomorrow morning. And where it says, in light of the Delta variant, I would say in light of the Omicron variant.
Omicron, yeah.
And that's really it. And this may not be perfect, but we can revisit it in January. We can even revisit it sooner if somebody feels the need to. But as far as meeting today and approving something, I think we've got, I took notes on what we talked about, and I've emailed that to Karen, and I think it's sufficient for approving something today.
Casey has his hand up, Joe.
Yes, Casey.
Hello. Let me see. Let me make sure everybody can hear me.
Yes.
Yeah, I'm just going back and forth to the Bedford and Lexington one. I was actually over in Lexington when they passed theirs. I don't know if it's worth considering having, if you look at the last number 9 on the Lexington one, this turned out to be kind of rather useful over there. I don't know if the board would want to consider a version of this, of the language they had. They have it through the town manager, but I'll just read it. The town manager, working with the town staff, will develop criteria for considering for specific businesses, which will be submitted to the Board of Health for review and approval. And what maybe not so much that wording, it could be, the town of Concord may develop criteria, et cetera. And the reason that gives a little flexibility if you have a unique situation where a certain group or a certain body of business, what have you, it's pretty general, but it does give you a little bit of wiggle room if there is a unique circumstance that doesn't, you wouldn't think of. And that would allow the board or staff or whatever to consider, I wouldn't call it a variance per se, but more of a, maybe they can make special conditions or something like that. That came up particularly with the houses of worship over in Lexington. There was a lot that came out and said, well, what about the people that are speaking in front of the mass, or a rabbi or pastors, or whatever, so it was useful in that situation. I don't know if that's something the board would want to consider, just that kind of basic language of, considering specific scenarios, which was the intent of that.
And when those specific, can go back to the beginning, when you said specific scenarios got handed over to town management, can you go back?
Well, that's how they had it said over here. I think the wording would be better. Let me see. Let me just pull it up again.
Yeah, I like the suggestion, actually. I think that's a great suggestion. So
yeah, let me pull it up. I can kind of finagle some.
I can read it, Jill, just because I have it out already. So it says the town manager working with town staff will develop criteria for consideration for specific businesses, which will be submitted to the Board of Health for review and approval.
It could just be like the town of Concord may consider, or some sort of language that kind of opens it up, that if there is something unique, there's wiggle room, as opposed to like, well, it's all indoor places, that's the way it is, or you know what I mean. And it didn't get used a lot, but things did come up. Especially, I use that church analogy for the houses of worship, but it does give you a little bit of flexibility for something that you just can't anticipate that comes up, if there's whatever that may be.
Yeah. Does it get, it's funny because I must have not printed everything out from Lexington, because I don't see that part. I guess I just have their rationale printed out.
That didn't come out on mine either, Joe. That's
Yeah,
so
it's
funny.
interesting.
On their website, let me pull it up here. They have a nice website for just the mask ordinance. So they have when they started it, and then they have the mandate, and then they have the signage, but they also have the rationale. I think someone mentioned the rationale earlier.
Yes.
That wasn't necessarily part of their mandate. It was just kind of backup documentation of why they did the mandate. So on their website that's where I got the mandate from, that I was just reading about the language I was just mentioning.
Mm-hmm. Yeah, since I don't have it, I mean, it sounds like something that we might want to integrate as another bullet point here. But
Yeah,
you like that, Mark?
I like it. I think I would change it a little bit, given what Casey just described. So here's what I would proposed. So it would be a bullet, it would be a number 12
Mhm.
at the end of the list, and it would say the town manager, working with town staff, may consider circumstances where an alternative may be developed for specific businesses, which will be submitted to the Board of Health for review and approval. And I think what's nice about it, now, we may hate it because the town manager may get inundated, but I think what's nice about it is we could then make specific criteria and specific circumstances that make sense without us having to go back and amend this policy every time, right? So for example, we already thought about the pool, so we included it here, but had we not thought about the pool, it wouldn't be amending the policy. It would be a way to, come up with how to deal with the pool situation so that it didn't violate this, right? And so there could be other examples that come up that we're not thinking of.
Mhm.
That I like the idea of there having that flexibility.
So you could always put that in, Mark, and then like you said, at the next meeting, if it needs to be changed, it can be changed.
Right.
Mhm.
So
Um,
if people like that addition or a change to that addition, I'll email you this version, Karen, that has that in.
Okay, that'd be great.
I'm comfortable with that. I'm curious about town management that's on the call, what you're thinking. I know you're hearing a lot.
Is Carrie there still?
Yeah, Carrie, do you have any response to that? I mean,
I am here, and I do appreciate that there may be circumstances that arise in between meetings that need to be considered.
mhm.
I can tell you, I'm feeling a bit overwhelmed walking into this in this topic, but I know we have a great Board of Health staff. I know that we're shorthanded, and I certainly would be relying upon them for their professional advice to help craft some language to present to you to address any specific circumstances.
And I would encourage you to talk with other department staff that we're not thinking of here, because, just the departments that it's just out of it's the surprising cases that we're not thinking about, like.
If I'd like to add too, I mean, this wasn't, this isn't for everybody's kind of easy way to get out of it. We didn't get inundated with people wanting to make changes or exceptions or whatever. It's really more for the few logical considerations that may come up. I mean, someone says, I don't want to do it because it's like, no, that's not the intent of this, this mandate. I doubt we would be inundated with people trying to figure out a way to, lessen the impact or whatever. It's really more for the, more thoughtful things that come up, as opposed to just anybody wanting to get out of it or whatever. We weren't inundated over there in Lexington.
Mhm.
There was only a few groups that kind of came out and said, well, we have specific issues. The town kind of worked with them and the Board of Health and what have you.
Right.
I don't think it'd be overburdened. It wasn't, or a big burden for such a, to add this bullet.
Right.
Was just a quick question, do you have the criteria that you used, or was it ad hoc?
I'm sorry, for what?
Do you have the criteria
That the town staff had.
that the town staff used?
Well, it depended on the situation, and the situation, what was decided over in Lexington, this was really the main thing that was used for. There was, at the time, this was in August, a lot of the churches, there's a lot of churches and synagogues and houses of worship. I believe they made a compromise for those that are speaking and presenting it. And, they could be, what they decided over there, and it doesn't have to be decided here, but they considered what was going on, what the considerations were, and then they would get a test or something for the day of, I'm not saying it's right or wrong, but this is what they did. They any pastor or priest or whatever would get a test, the day before or around the time of giving mass, and they would be able to speak in front of their congregation without a mask. That was kind of the big thing over there when it came out in August. I'm not saying that'll happen here, or that's something to consider, but that's where that bullet point was very handy. But it gave them the flexibility to come to an agreement that would protect the public and work with the situation at hand. I'm not saying that's why the bullet was made, that bullet point, but that's an example that came out of it.
Right, but it'd be really helpful if there was like set criteria that were established by the town that we could easily adopt, like when, actually, I'm not even sure what they would be. I mean, I keep on thinking about Kerem Shalom, where I'm a member, which is really interesting because our rabbi is deaf. And mask wearing is a real impediment. He's an expert lip reader, but he can't read lips when people are wearing masks. So Zoom meetings have actually really helped in terms of worship over at Kerem Shalom, but it's not, but him speaking from the pulpit, it doesn't matter. From the, from the beam, it doesn't matter what he's doing because everybody else is masked. We can hear him. It's an interesting dilemma. And it's one of the few cases where I think that Zoom meetings have really been a benefit for this particular rabbi. But that's neither here nor there.
And the various churches in town, there's a lot of choirs and singing. So a mask doesn't help in that situation.
I've also seen a lot of choirs that have worked beautifully with masks this year, and they're doing it. So I wouldn't say that would be an area that I would think you'd suspend mask use. I think it's a really important area.
Yeah, no, I agree. So just speaking from someone who goes to First Parish, what they've done, everyone is masked, the windows are open, there's actually fans blowing, it was freezing last week. Even the choir's all masked. The only person that takes their mask off is whoever is speaking at the pulpit at that moment. And when they're not speaking, they sit down and they have a mask on. And when they're speaking, they're frankly are spaced, far from everybody, right? And so to me, at least what they've done, now we could decide they've got to still wear a mask even then, but to me, what they've done makes a lot of sense other than freezing and having to wear long johns to church. I think they've done everything very, very safely. And that, to me, that's an example of something that would be a reasonable accommodation, which I think isn't about a particular church, but it is about a particular setting, right? So that, I think in that setting, it works because there's space. I think I can imagine other settings where there's not distancing or it doesn't work, or where somebody, to Casey's point, the speaker actually has to get tested before they do it as a different approach or whatever, right? So I think these are all examples of where we can't have a 30-page mask mandate that gets into every specific situation. But I think especially the houses of worship, maybe someone needs to reach out to them and just coordinate on, if what they're doing works or if there should be a tweak to it.
Carrie?
Thank you. As you were talking, I was just thinking of an example that we had talked about at a staff meeting recently, where we would probably need some additional consideration, and that has to do with our public safety and public works response. We have individuals, multiple people in a fire truck or in a large piece of equipment, and wearing a mask and driving with glasses can be problematic. So this is something that we would like to be able to address internally. We certainly would be happy to share with you what we are thinking, and if the Board of Health thinks it's appropriate to add that into a mandate, that would be fine, or if that's something that's just employer specific, we could handle it that way. But that's an example of something that it would be much easier for us at a staff level to come up with some recommendations.
So that goes back to point number 9 here, about this, you got this town submitting to us some of those special conditions, special situations that some exceptions need to be available. So then is this phrase?
Number 9 on the Lexington one.
Yes. So I'm wondering
number 12 on ours. Okay.
Yeah, the new number 12.
New number 12. All right, is there anything else to amend on the Bedford document? Which, Gabby, do you mind showing it to us again, please? Thank you. Are we good with this one? So are we ready to make a motion to accept to work with this? I'm not even sure what the motion is at this
Well,
point.
the
So-
motion. Go ahead, Mark, I'm sorry.
Yeah, I was gonna say, I move to adopt a mask mandate consistent with the discussion at this meeting.
I second that.
Okay, and all in favor, I vote to approve.
I
I
approve.
vote to,
Okay, Ray?
I approve.
I
Okay,
approve.
Okay,
I approve.
thank you. Okay, so we're good.
So this will go into effect as of 12:01 tomorrow, right? 12:01 a.m. tomorrow. Mark's gonna send me his edited version. I will create the doc. I'll send it to all of you and then then once you guys all give me your okay, I'll send it to News and Note. We'll send it to our for news and notices, right? For a blast out to the town. Is that how we want to go, guys?
Yeah, I think
Gabby,
so.
Casey? Yes, okay.
Gabby, in case
Marcia?
we talked about having signage examples. I know that a lot of these examples came with them. You probably have that, but that would be another thing to include. And then Ray and I will also look at some of the rationale documents and come up with a more concise version. Ray, are you available to do that this afternoon?
I can do that, yes.
Okay.
But that will be something that we'll put on, we'll post later on as part
On
of
the
our
website.
COVID-19 information, yes?
Yes,
Okay.
it doesn't have to be
Can I
part
ask
of
one
this.
more? Can I ask one more question about the signage?
Yes.
There's not a whole bunch of signage here that we looked at. What is it that the board, I mean, they had signs previous.
Yeah, I don't think we need to get into anything fancy. I think somebody made the suggestion that we provide examples. I know that I don't think it has to be
Not
difficult. I mean, there's that
mandate,
very
right?
basic one that usually has a picture of a mask and says required indoors, whatever, something like that.
Yeah, I mean, the ones in Lexington next door, you can just put Concord. I mean, they're pretty simple. The main thing is, I think they were called out over there, is definitely has to have the language about medical exemptions. There's a group or an individual that's been calling out towns that put signs out that don't give that exemption. I mean, it wasn't a huge deal, but we went back and added that exemption to the sign, and everybody was
Sudbury
happy.
has
But
that
that was
clearly.
one of the things that has to be on it, or should be on it.
The Lexington website has the mask mandate. There is an exemption for medical conditions noted at the bottom of that.
Yeah, exactly that.
That seems to be suitable for our needs. Yep.
It's like an under 2 years old. Is that the guidelines, I think?
It doesn't say under 2, it just says medical conditions.
Right. I think though, in terms of, I don't know if we need to specify, but I believe the CDC recommendation is not under the age of 2. It's really hard to
So,
have a baby.
so
with it.
we certainly could add that language plus the medical condition exemption as well.
Mhm.
It's just simply something simple that a business owner can download and just post on their door or in
If
their
you look
window.
at Sudbury's, which was it's just one page, very simple, effective the date, face covering required in all indoor spaces regardless of vaccination status. And then it says unless medical exemption
Mhm.
with the mask.
Thank you, Gabby. I was just going to ask. Oh, which is this?
I can't do my, I
You can
can't,
have- you can-
my laptop won't work. This is my personal laptop.
Yeah, I mean, the rule we just passed,
There it is.
right?
Right there.
Nice.
Is, all individuals 2 and above, and unless someone's unable to wear a face covering due to medical condition or disability.
Mhm.
Okay, so we could add that.
Unless medically exempt, disabled, or, well, disabled is so broad, so.
Well, it's not disabled, it's unable to wear a mask,
Right,
because-
right.
a face covering because of a medical condition or disability, right? It would have to be,
Mhm. So
Add to
does
the-
unless medical exemption cover it all?
Does that cover it?
that's
Mark?
fine.
Do we need to specify unless, unless medical exempting or underage too? I haven't seen that specified. I don't know if anybody's come up, had issues with that. Okay, we can hear, I mean, if people are upset about this, or if they can't interpret it for themselves, we'll hear, right? So. Okay. Are we done?
I think we just need to cover how we are going to get this out to the business community, because that's largely who will be affected.
Okay, so news and notices they don't get, how have you done it in the past?
Recently, I think it went via Beth Williams. Is that correct, Marcia? The last Board of Health meeting urging went through Beth Williams.
I think we did it both ways. We'll do it every way we can to get it
Yeah.
out. We'll go through Erin Stevens, and Beth is currently on vacation this week, so she's not going to be able to get it right out.
Okay.
And
Who
there's
is
no-
Beth?
I'm sorry. Who's
I'm
Beth? I'm sorry.
Beth Williams is our Economic Vitality and Tourism Manager. And so she has been working closely with the Chamber of Commerce. We might check with Marie Foley, who is the chair of the chamber, and see if there is another way of getting it out to chamber members.
Do we think it would be appropriate to use the police street signs for the first couple days?
Absolutely.
That would be helpful.
Chief O'Connor is listening in. I don't know if he is available to comment on that, but
I'm happy to comment if the chair would like me to comment.
Please.
Yeah, so yes, would be more than willing to use those for a short period of time to put that out there. And if I could just make a comment, our officers have been working through the pandemic, exposed, worries their families, concerns, just like everybody else in the general public. And when the first mandate came out, our officers, their union, none of them opposed being the agents for the Board of Health. We were very understanding at that time. So I'm not sure if we're any different than any other work population as to our feelings on masks. Thank you.
Thank you. I hope I didn't misrepresent anything earlier. It was unintentional if I did. I appreciate the work that you guys do. Okay, so yeah, some signage would be really helpful. Those electronic signs I think are great. And however else we get it out.
Is this effective? I think someone already mentioned, is this effective tomorrow?
Midnight tonight.
Tomorrow. Yeah.
Okay.
Or midnight tomorrow, yeah.
Yeah, 12:01 a.m.
12:01, December 28th. Okay, assuming that Karen, you can turn it around that quickly.
We can do it.
Thank you, appreciate that. Okay, any other loose ends? Okay, well, I really appreciate everybody's attention to this. This has been 2 hours. I'm sorry that we had to have a special meeting for this. I mean, it's really amazing that it just, I think the information we had changed dramatically just even in the 2 weeks since our last meeting. So, so thank you for your full attention to this morning, and we will rediscuss on this on January 25th. Okay. Thank you all. I think.
I'll move to adjourn the meeting.
Oh yeah, we have to have a vote on that.
I
Yeah.
second that.
Okay, all in favor?
Aye.
Aye. All right, we're good.
Thank you.
Thank you all.
Thank you,
Jill.
Jill.
Happy
Okay.
holidays.